Hello, everyone. So, my name is Dr. Tracy Hicks. I'm a dual certified nurse practitioner in family practice and mental health. I have a practice that I started in 2015 and in 2020 established a nonprofit and received funding from SAMHSA for planning, development, and implementation of a community behavioral health center. I'm also an educator and a care partner. I really think that clinicians need to always remain curious because there's more to every patient has a story. And you might hear me say client, but every client has a story. And we certainly need to remain curious and not get caught in our own thought processes about what a situation is. And what I've seen in practice is that and in talking to clinicians across the country is that curiosity is often lacking, and it's not intentional. It's just we get caught up in our day to day and we just need to ask more questions. Really find out who the patient is and their care partners and meet them where they are. Issues of daily living, I love that piece. And the questions, going back to remaining curious, start by saying, tell me about you. What is it that you would like to achieve in today's visit? Or is there something that you used to be able to do or you want to be able to do that you haven't been able to do? And I'm telling you from experience, you learn so much from that. Just those simple things is, again, taking it back to remaining curious and meeting the people where they are and building that rapport, which is so important. Kind of questioning that clinicians can use to get to that understanding of the patient is, tell me more about you. It's like if you're talking about a particular treatment plan, tell me what you think about this treatment plan. And do you feel like you're able to do the treatment plan as we talked about? And if not, tell me more about that. I want to understand. And of course, not just step by step. I'm just giving examples of questions, give them time in between to think. You learn so much. Again, I know I sound like a broken record in being curious, asking more questions. And so, what is your goal for today? And if they tell you a goal, what does that look like for you? What stops you? Or what are the barriers? What can I help you with? What resources do you need? So I can give you a prime example. There was a young man who was recently incarcerated, and well, he was released from prison, and he had been hospitalized for a psychotic break. And when we got into the office, he was not in reality. He was saying some things that didn't really make sense. That's what we call tangential conversation. But I met him where he was. I said, I understand this is what you feel and this is what you're hearing, but tell me more about you because I care about you. I want to see you do better. And he stopped and he looked at me and he said, what do you mean you care about me? And I said, well, I care about you and you achieving the goals that you want to achieve today. And he said, nobody's really said that to me. So and it was like there was this piece of him that had been untapped. And so as we got into the visit, we did, just our usual assessment. And I said, I'm going to ask you a lot of questions. And he said, usually people just dig in and start asking me questions. They don't tell me what they're going to do. And so, this helps me. And so I thought, we still have work to do. And again, as providers, it's not intentional, but just taking some time to pause, it really makes a big difference. Again, remaining curious. People need to understand that you care. They need to know that you care. And when you're dealing with something like schizophrenia, understanding that it's not an identity, it's a diagnosis, and people are people first. I would say that, we have our screening tools and those are great, but what can you glean from those screening tools once you get that assessment? Like, for instance, if you did a brief psychotic scale, once you got that information, what are you going to do with it? How can you turn it into curiosity? You said this on the form, so that way that form is not disconnected and they don't feel like they're getting this extra cognitive load for nothing, right? You really use that form to say, hey, you answered this like this. Tell me more about that. It makes a big difference.